My philosophy has always been to enrich the lives of those around me, and this is a great time to take that into my practice as well. I've been in practice as a pediatric dentist for 2.5 years, and what's prompted me to do this video about my philosophy as a pediatric dentist is so many questions about that from my colleagues, especially my referring doctors. So for you colleagues, my referring doctors, a little bit about me to help you know who best I will serve and who maybe I won't serve well. That philosophy really holds true for me. I've learned a lot of empathy from my mother, a lot of altruistic attitudes from her as well, so thank you, Mom, for that. I use a lot of compassion, and I train my staff not to be judgmental at all when it comes to children and their behaviors, and even adults, parents, because parents are taxed sometimes by their children, even when they come in. I'm sure that there are some times where they're like, oh, I wish I could have gone into that whole situation and that whole practice experience with a different attitude, but we understand that. We're compassionate about that. So with that and that ability to welcome parents in and patients with a non-judgmental atmosphere, it goes a long ways, and we frequently get parents say, I felt so relaxed, and I often interpret that as meaning they didn't feel judged. I've really done a lot to create a serene environment in my practice. Unlike some of my colleagues that want to stimulate an environment, I've actually done everything I can to create an environment that is very interesting for children, but very soothing for parents, especially my mothers. That's a big deal for me. I want the children to also be in an attitude or develop an attitude in an atmosphere that's not overstimulating. And I have testimonials coming out of my pockets that say attest to that fact, so it's pretty cool. I've been able to hit my mark there. My practice is one too where, again, I train my staff very much to be and think that same giving back to others, and that philosophy overrides everything we do. I work on standard operating procedures. I've probably developed hundreds myself, but I would say for the most part my staff, they contribute at least 2 standard operating procedures a week, and by doing that they're able to quantify and qualify their job description. So if something happened to them or they had to train someone on the spur, that would be a pretty easy thing to do. Standard operating procedures in my practice, we wouldn't practice without them. It allows us to have a certain set of rules, but also it gives us the freedom to customize and optimize treatment for each individual child, because without those parameters to know what we'll stand for and what we won't, it would be very difficult to make decisions, and I'm all about being very decisive. As Dr. Ashley Elmer said to me once, boy, you know exactly what you want, and I do for most of the time. Not always, but for most of the time I know exactly what I want to do and what the final outcome will be. For me, it's all about my patient's best interests, and sometimes that doesn't match with what a parent would desire for their child, so that takes some time and some compassion, sitting down with the parent and spending time mostly listening to what their fears are, their desires, what their wants are, and their needs. That's a huge thing in pediatric dentistry. A parent needs to feel listened, and a child needs to feel appreciated. So we use respect, we talk tactfully with our children. We don't baby talk children for the most part, although there's some real cuties that it's hard not to, but we really do treat each child with the utmost respect, and we get to know our patients that way, and our patients know it. It's not just something we read off a flag or a prompt. We really truly get to know our patients and our parents, and again, that's a huge deal. Customer service is huge for us. We can't be beat. I can guarantee that. Also, when you're referring patients to us, you want to know that restorative care done on an elective basis, we separate by a week between appointments, and that keeps our patients liking to see us. They don't feel inundated, and they have a little bit of time to recover and refresh before their next restorative appointment. As far as restorative materials we use, I know general dentists are very worried about stainless steel crowns, and I know that a lot of general dentists fear that pediatric dentists just throw them at patients willy-nilly. We don't. I can, of course, not speak for my competition, but I know for me, myself, a stainless steel crown is sometimes just the last resort. For a tooth, for me, that has 3 surfaces or more decay, and I have decay interproximally in every quadrant, that does become a very good restoration of choice. But I talk to the parents too. What is their wishes, their desires, and what is their aesthetic level that they would feel comfortable at, and what would they not feel comfortable with. If I can, I like to guarantee my work, and so if I can guarantee my work on a child, I definitely will let parents know. But if I'm compromising to meet that patient's best interest, but also keep a parent comfortable and happy. Sometimes I'll let them, I always in that case would let a parent know, I can't guarantee this, but I'm doing it because I know it's meets what your child needs, and it's also making you happy as well. But because of it, here's some limitations. So I really do work well with the parents, and I do try to meet their needs, but also, and always where I draw the line is I have to meet the patient's needs as well too. I have about a 2,500 patient base right now, and of those 2,500, I can only recall twice that I had to draw the line and a parent wasn't able to accept that, and so unfortunately had to leave our practice. In those 2 occasions, though, it was very amicable, and I know both parents felt heard and listened to. They just chose to not do that because they felt like they were compromising something as well. And it has to be a win-win for it to truly be a successful practice. And it's not going to fit. My practice won't fit everyone like a glove, but it will fit most. And I really feel that that is true, and I know it to be true because it's only been 2 out of 2,500. So hurrah there. Restorative materials, probably in use or in frequency, I'd say composites are my number one. I use Filtac. I do isolate, and I use rubber dam isolation for composite restorations. I use comprimers. Filtac is a comprimer I love. Fuji Triage, another great comprimer for sealants, and especially areas of operculums are present or partially erupted 6-year or 12-year molar. Can't isolate that, and you'd love to seal it because you know what's coming if you don't. But in those cases, a comprimer is a great way to go. I use some glass ionomers, Fuji buildups. And the next most frequently used restorative material in my practice is the stainless steel crown. I do some amalgams, but not a lot. Amalgams are tried and true though, and in certain situations, even on permanent teeth, and a very poor oral hygiene patient who is resistant to change, that is pretty much the only material of choice. So, I don't discredit any of the materials, but I definitely do go into it making sure parents know exactly what to expect. On my blog, I'm going to post a handout that my patient coordinator gives to every parent, regardless of insurance, because I sure don't want to know what insurance they have or what their financial disabilities or income might be, because that may make me actually treatment plan differently, and I don't ever want to treatment plan other than what the patient's needs are and what's going to serve the patient well. So I don't know any of that, but when a patient does go up front and they receive their treatment plan so they know exactly what's going to happen next visit, they also receive a handout that explains the restorations. I always explain things like stainless steel crowns as a silver crown. It's going to fully cover the tooth and it's going to appear silver. I refer to new smile crowns, which is what I prefer to place in the anterior, as a stainless steel crown with a veneer coating of a white restoration. They're very tried and true, and they look actually beautiful. And I show parents our before and after photos. We show them different photos of frenectomies, be it from a maxillary frenum to an ankle glossia patient. Anything that we can show in a photograph we do. Knee to knee examinations. We do complimentary 10-minute consultations for parents that just need a little bit more Dr. Molly time in order to feel comfortable with the treatment we've talked about, or even ask questions, learn more about the physiology of the tooth and just some of the biology that goes along with it as well too. And I do frequently get parents that take me up on that, and it's actually probably the most rewarding time in my practice, is just getting the parents educated, because that's what it takes. A lot of children just don't have that wherewithal yet to look full term down the road and see what consequences they may have to live with because of their poor choices now. It's just they just don't have those skills yet in their repertoire, the experience that they need. Parents do. So when you can educate a parent and you get them motivated, you're sitting pretty. So a little bit about my philosophies. I hope this helped. If you have any questions at all, any of my referee docs can call me 24/7 by just calling my office, and I am paged immediately and I respond within minutes. So please, I encourage any of you to call me at any time to find out more about my practice philosophy, more about my restorative materials, more about me if you'd like. Although I'm pretty boring, I'll probably ask a million questions about you, because we do refer back a lot into the community to our pediatricians, our OBGYNs, even some geneticists, you name it, and definitely to our dentists. So I thank you, referring docs, so much, because I wouldn't be where I am today without you. Appreciate your referrals. Thank you.